Okay, hi everyone. Welcome to Nashville General Hospital's Wellness Wednesday program. I'm Kathy Poole.
And I'm Kaylin Harris.
Our goal of Wellness Wednesdays is to share information vital to your health and wellness. This week, we would like to introduce you to Dr. Nathaniel Klein, a highly specialized GYN who provides patient care at our Nashville Healthcare Center Midtown location off Charlotte Avenue.
Dr. Klein is one of Nashville's minimally invasive GYN surgeons who completed a fellowship in this area to become an expert. From mixed and augmented reality healthcare application to minimally invasive surgical procedures, Dr. Klein is on the cutting edge of healthcare and technology.
Dr. Klein, can you share with us some exciting things going on in the GYN division of women's health here at Nashville General Hospital?
Yeah, I'd love to. So thanks for having me. I'm super excited to be here and I'm excited to talk about what's going on. So there's a couple things I'm working on, and the two areas I think that are most exciting right now are two procedures brand new that I'm bringing to the hospital and really Nashville and Tennessee at large. One of them is called V-nodes, and that is a different modality for minimally invasive GYN surgery. And the other is called the Accessa, which is it's a laparoscopic procedure for fibroid treatment. Every year, there's an estimated 500,000 females who are undergoing hysterectomy for various reasons: chronic pelvic pain, fibroids, heavy bleeding, prolapse. And it's exciting that Nashville General is going to be one of the first hospitals in the city and really the state to offer V-nodes, which is this minimally invasive hysterectomy procedure that has a ton of advantages compared to other approaches, including laparoscopy and robotic surgery. And that's to improve the benefit for shorter hospital stays, less postoperative pain, no visible scars, and faster recovery time. And this is because the surgery route is using a natural orifice in the body by doing laparoscopic surgery through the vagina. So there's no scars on the abdomen, and doing a surgery in the most minimally invasive ways is best for the patients. So this is really exciting to start to perform for our patients, and can't wait to get started. The other procedure that I'm bringing to the hospital is called Accessa. So Accessa is primarily for the treatment of fibroids, and uterine fibroids are very common. If you want to move on to the next slide, Kayla. Uterine fibroids are very common. Most women have fibroids, and most of the time they're not causing any problems. And however, they can cause a lot of problems, and that's really heavy bleeding, or painful periods, pressure in the pelvis, fertility issues, and others. And the Accessa procedure is a minimally invasive way to provide some treatment instead of doing a bigger surgery where you're removing a fibroid, which is called a myomectomy, or potentially a hysterectomy. You can use this Accessa procedure, which is a laparoscopic radiofrequency ablation. So it's putting little needle electrodes inside the fibroid to destroy the fibroid in a minimally invasive way, so patients can leave the same day and recover a lot faster and get back to work in their life. And most patients have great success for improvement in their symptoms. And actually 98% of women in a clinical study recommended Accessa, and 94% of women said the procedure helped with their symptoms. Now, this doesn't mean to say that this is going to be for everybody, but being able to have many options is what's great, and being able to tailor different treatments to various patient needs that is perfect for them. And that's really what I want to do. So one part of the fibroid treatment that's really exciting at Nashville General is we're creating a specialized fibroid team that's just dedicated for the treatment of fibroids. And that's with interventional radiology for uterine artery embolization, which is another procedure, hematology, since there's a lot of bleeding issues, so that we can optimize our patients, and that we're all working as a coordinated, specialized team to provide the best care for our patients. So this is super, super exciting, and I'm glad that I'm here to be able to do this and bring this to our patients.
Perfect. So Dr. Klein, I do want to ask, so when it comes to the accessive procedure and the venous procedure, what are the benefits of care for both procedures?
Really, it's doing surgery in a minimally invasive way. There's different options, but it is shorter hospital stays, faster recovery, less postoperative pain. Now, there's some nuances because this isn't for every patient. And some patients, there wouldn't be the best option for them. But being able to have all these options and bring the most advanced, up-to-date procedures and technology to our patients allows us to pick and choose what procedures really are the best for our patients.
Perfect. And then, so who would necessarily qualify for both of these procedures? Like, are there certain demographic types? Are there, as far as like age, race, who would exactly qualify?
So for the accessible procedure, it has to do with fibroids. So kind of the symptoms and management related to the problems that fibroids bring. And the other procedure, V-notes, so this is the modality of surgery where we're providing surgery through the vagina in a less invasive way. So really, if any of our female patients are talking about surgery, and for whatever the reason, it can be fibroids, and we can talk about excessive, or it could be some other reason for surgery in the pelvis with ovarian cysts or sterilization or hysterectomies. A lot of different procedures, even fibroids for the V-nodes, we can see if that's a great option for them. And the best thing is to know that you have options and to really talk to your provider about if they're a great candidate for this, and to ask questions about it. And patients are happy to call me or come and see me at any time to learn anything about this. And really, it's sitting down and talking with them to give these options to see if this is even a great procedure for them.
Okay. And we actually just had a question come through on our Facebook stream. So the question is, will my physician know about these options, or can I ask them about these options for my situation?
They may know about it, but it is fairly new. And so I like to be at the very cutting edge. That's where I'm really excited about medicine. And so not everybody knows all of the best stuff that's out there, the newest things that are out there. And some of these are, for V-nodes, being one of the first in the country is exciting, but that means that not a lot of people are doing this, and there's not so it's hard to get really good information. So your doctor may know this, but they may not. And asking those questions are great, because you can always go for a second opinion. You can always learn and ask questions. And that's the best part, because maybe it's not a perfect thing for you. And maybe that's an opportunity to work together with your doctor and train them and help them learn new procedures and kind of go forward, because really at the end of the day, this is our community.
Thank you.
Yeah, that's some exciting information. And knowing that you're on the cutting edge of this technology and only one of a few doctors in Nashville, why Nashville General? What drew you to us? I think, it's been a great fit, but, you're new to the area. You've been here a couple of months. So share with us some of the exciting things about Nashville General Hospital.
I didn't know really anything about Nashville before I came here for this interview. And I have to thank my wife for that, for having me come here. And I'm so glad that I did, because trying to affect change is really hard, especially in healthcare, and trying to move a ship that's massive and has done the way they do medicine forever is really hard to change the direction. And just change in general is really hard. And what I learned coming here is Nashville General, it has this spirit of people really care about giving great healthcare and being there for our patients. But also the culture is perfect for change. People want to keep getting better and growing. And for me, that's really exciting, because I love being in the forefront of medicine and kind of what's happening next, and being there, plus in a culture where everyone wants change and is looking for the future. That's my ideal situation. And so I'm super excited to come here and to be given this role to kind of start this department and grow it. And so I'm excited to see where things are going to go. But it was a perfect fit for me.
I think it's exciting as well, especially if other providers hear about what you're doing. the services that you provide through V Notes and Assessa, and just knowing there is somebody in town locally, right down the road, right in the medical corridor of Nashville, who's able to do all of this is impressive. And then we do have the Metro Healthcare Incentive Program. So any Metro employees out there, you can utilize services here without incurring copays or deductibles. And talk about there's one of the things you and I talked about in the past about, hysterectomies, your doctor might say, oh, it's time for that. But the procedures that you're able to do, the timeline, like maybe your recovery time isn't nearly as long.
Yeah, so there's a lot of surgery that's being done, and what I've learned in fellowship is the more you do, the better you get at it, and that's what the research shows. And so the being able to provide minimally invasive options for patients, they can get out of the hospital faster. Before, when they're making a big laparotomy incision, so big incision on the stomach, you're in the hospital for several days recovering before you get to go home. And if I'm doing a hysterectomy, I would say about 98% of my cases are minimally invasively, and those patients are almost always able to go home the same day. And the recovery time is a lot faster and better, and patients are happier by recovering at home rather than at the hospital. But it's not mean to say that you're going to go home if it's unsafe, and there's definitely reasons to be admitted to the hospital, and we're going to do whatever's best for each patient. But it is being able to offer these things, and which is really exciting.
And just on the insurance side, both of these procedures are typically covered by insurances?
So the V Notes is still, it's nothing to do with the procedure. It's just a different way you do the surgery.
Okay.
And so if you're doing a hysterectomy, it's still a hysterectomy. So yeah, it's definitely covered. The Assessa is a new procedure, and it's covered by most insurances, and it's being more widely adopted, but it's a medical device for kind of a change in its management. And so I'm not sure that the current landscape in Tennessee, but the medical device company has been wonderful, and it's very helpful to kind of get this through, because it is a big benefit for patients. So and as part of figuring out what your best options are. But I would say I'm pretty sure that it's accepted by most of the insurances, if not all.
All right. And then just based on that, so anybody going to their OBGYN, having an annual health screening, and then deciding, oh, you need more advanced care for a GYN, that's where you come in. So do they have to have a referral or no?
No, they don't need a referral. So that's my expertise, is complex surgery. If you're talking about surgery, that's where I can help the best. But that's not the only thing that I do. That's where I spend almost all of my time, and where I think I should spend all of my time, because that's where what I'm best at. But the more complicated the surgery, and that's where it's better referrals to me. But even if it's straightforward, or even just talking about your options, just to know what's out there to see, and that's still providing great care. And that knowledge base is something that I definitely want to offer to any patients, whether you're going to go through surgery with me or somebody else, or whatever it might be. But that I also take care of regular, normal day-to-day issues too, women visits and all of that stuff.
Okay. Perfect.
Yeah.
And then before we wrap up, Dr. Klein, we do have one more question from Facebook. So the question is, I heard you are fellowship trained. What does that mean, and why is that important? So
that's a great question. I'm fellowship trained in minimally invasive GYN surgery, and this is an expert. It's an additional level of training after residency. So after med school, you're a doctor. Go on to residency, and that's where you specialize into your field of medicine. For me, that was OBGYN. After OBGYN, I can go out and practice just like any other obstetrician gynecologist in the country. However, doing this additional level of training for minimally invasive GYN surgery is so much more surgery, and it's got me to be an expert in this field. And instead of taking an entire career to be honing my skill and my craft to be a great surgeon, which there's a lot of great surgeons who are general OBGYNs that can do amazing jobs at their surgeries. But in my 2 years of fellowship, I was doing 1,500 cases a year, and that's roughly, for a GYN a general GYN that's around 10 cases a year is on average what most people do. So that's roughly 150 years of extra training for the start of my career. So it's being able to do a lot and see a lot, and to have that repetition that you can provide better outcomes. And so that's what I'm bringing and get to do with fellowship. It was hard to go continue and stay in school and keep working so hard, but luckily enough, this is my passion. I would do it again and again.
Okay, perfect. Well, thank you so much, Dr. Klein, for being on today. And that is all the time that we have. We thank everyone for joining us this afternoon, especially you, Dr. Klein. And if you want to schedule an appointment with Dr. Klein at our Nashville Healthcare Center Midtown location, please call 615-341-4419. Once again,
You know,
oh, wait,
sorry. There's one thing I would like to add is, even if you're talking to your OBGYN and you love your OBGYN and you're talking about these options and they don't know it yet, I would love for an introduction and to talk about this, because I'm brand new to the area. And I think part of what I can bring isn't just to our patients, but to colleagues, and to really work on these next things, and being connected and kind of talking through all of this stuff. And hopefully I can get involved in training and kind of staying in that forefront of medicine. And so I definitely want to work with my colleagues in the city.
Well, again, if you would like to schedule an appointment with Dr. Klein at our Nashville Healthcare Center, please make sure you call 615-341-4419.
Also, don't forget to mark your calendars for next week's Wellness Wednesday event, highlighting Patient Experience Week. Nashville General Hospital's strategic goal is to achieve the Institute for Healthcare Improvement's Triple Aim. The Triple Aim framework focuses on population health, per capita cost, and experience of care, and serves as the foundation to successfully improving patient outcomes. We'll be joined by Sean Howe, Nashville General Hospital's Director of Patient Experience.
Thank you again, Dr. Klein, and everyone who has tuned in. Also, if you do have a question for Dr. Klein, you can still post your question in our comment section. We will be sure to get it over to him. We'll see you next Wednesday, April 7th at 12:15. Have a great day.
Bye.